Recently, the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, publicly expressed gratitude to Prince Harry and Meghan Markle following their visit to Jordan. He praised their compassion and generosity, highlighting how their presence drew attention to urgent healthcare needs, from injured children and mental health services to refugee assistance. On the surface, the message sounded diplomatic and appreciative, the kind of formal acknowledgement global institutions often give to high-profile visitors. But the online reaction has been far from routine. Almost immediately, debate erupted. Some critics began questioning whether the endorsement reflected genuine impact or whether it was more about optics. Because in humanitarian work, timing matters, context matters, and perception matters enormously. The controversy isn't centered on whether healthcare crises deserve attention, they absolutely do. Nor is it about whether compassion is valuable, it clearly is. The real issue critics are raising is far more specific. What measurable difference did the visit actually make? Did it unlock new funding streams? Did it influence policy decisions? Did it create expanded medical access or humanitarian corridors? Or was it primarily symbolic? Supporters argue that symbolism has power. Visibility can amplify neglected crises. When globally recognized figures show up, cameras follow, and attention can translate into momentum. But detractors counter that symbolism without substance risks becoming performance. In today's media-driven landscape, there's a fine line between advocacy and image management. Another layer of criticism focuses on hospital visits and public imagery. Whenever prominent figures visit vulnerable patients, especially children, ethical questions naturally arise. Issues of dignity, consent, and privacy become central. Were patients fully comfortable? Was consent clearly obtained? Was there any pressure, direct or indirect, to participate? It's important to be clear, there is no verified evidence that anyone was forced into participation. That distinction matters. However, in humanitarian contexts, perception can carry as much weight as documented fact. If even one interaction appears awkward or overly exposed, public discomfort can grow rapidly. And in politically sensitive regions, where tensions run high, scrutiny intensifies. Even well-meaning gestures can be interpreted as misjudged or poorly timed. Some critics go further, arguing that the Sussexes operate within a highly curated public brand, meaning any humanitarian engagement is inevitably intertwined with media strategy. That critique isn't unique to them. It reflects a broader modern debate about celebrity philanthropy and the merging of activism with branding. Online, some commentators have even used the phrase tragedy optics, blunt wording that reflects frustration among those who feel humanitarian crises should never become visual backdrops for polished appearances. There's also a geopolitical dimension. The region remains volatile, with shifting developments and fragile dynamics. In such environments, even sincere efforts can be perceived as tone-deaf if the timing feels misaligned. That perception doesn't automatically imply bad intent, but in global crises, optics are unforgiving. By publicly endorsing the visit, Tedros effectively framed it as constructive and impactful. That endorsement has now become part of the debate. Critics are asking whether it was standard institutional courtesy or a move that aligned with broader media narratives. There is no evidence of private coordination or PR pressure. No documented proof of behind-the-scenes influence. What exists instead is public interpretation, and interpretation can shape reputations quickly. Prince Harry, in particular, has faced recurring scrutiny. Some detractors claim that previous remarks about humanitarian access may have overstated realities on the ground. If true, that could damage credibility. If not, then the criticism may reflect political bias or selective framing. But credibility is everything in humanitarian advocacy. When public figures speak about conflict zones or crisis regions, precision matters. Facts must be carefully chosen. Overstatement, even unintentional, can undermine trust. Ultimately, this discussion goes beyond one visit. It's not solely about Tedros, Meghan, or Harry. It reflects a broader tension between celebrity humanitarianism and institutional accountability. Should high-profile private citizens play visible roles in global health narratives? Does their visibility strengthen causes, or risk overshadowing frontline workers who have labored quietly for years? When international leaders publicly praise celebrity involvement, does that enhance collaboration or blur the lines between governance and branding? The strongest criticism emerging online isn't that the Sussexes lack concern. It's that skeptics question whether the scale of publicity matched the scale of measurable results. In crisis zones, humility can carry enormous weight. Quiet diplomacy can sometimes achieve more than highly publicized appearances. Yet we also live in an era where attention itself functions as currency. Awareness can drive donations, partnerships, and policy focus. So the deeper question becomes this: was the visit primarily about elevating the issue, or elevating the individuals associated with it? That's the tension at the heart of the debate. Tedros chose to publicly affirm the contribution. Critics chose to publicly challenge its depth. In today's media environment, both narratives can coexist, and both will continue to circulate. But beyond personalities and headlines, the most important measure remains simple: did children receive better care? Did patients gain improved access? Did refugees experience sustained, tangible support? Because in the end, media cycles fade. Outcomes endure.